see you over here. We are holding this in between two simulators. The context is like we want to know a little bit more about, the simulation, what's happening around the world. And the first things first, it's interesting for us to know, you come from a background of medicine as well, and you get into simulation. How was that transition going? What did make you pick up, the simulation path?
Very good. Thank you so much, Raul, for having me here. That's a very good question. So, as you said, I'm a critical care physician. I have an internal medicine background. And I took my residency, my ICU residency at Albert Einstein Israeli Hospital in Brazil. And they have an amazing simulation center. I believe they're the first major sim center in Brazil. And during my residency, I had a lot of contact with simulation at Einstein, and that sparked me the will and the desire to learn more about simulation, because I saw as a learner, as a resident, how good that was and how that made me really learn whatever skill they were trying to teach. So I moved out of the country in 2014 because we didn't have any deeper learning or a fellowship or a postgrad course in Brazil, and I went to the VA in San Francisco, the San Francisco VA, in a partnership with UCSF, where I took a 2-year fellowship in advanced clinical simulation with Dr. Richard Fiedler and Dr. Jan Hirsch there. So that's what made me move towards teaching, and especially teaching with simulation.
Wow. So that is how you started. And what is actually keeps you excited about the simulation right now in Brazil? Like you are right now, like at the head of the simulation, the Sobrasim. So what are the things that attract you, to be there?
Yeah. So at first, when I moved to the US, I was just interested in simulation. I was just trying to learn more about it, and I didn't know how would that play out or how would that work. I just had the experience of knowing and being a learner, but never as being an educator or as an operations specialist. So after taking the fellowship and starting to work with simulation in Brazil, I had a deeper understanding of it. So now I understand how it works and how well it can help residents and nurses and medical staff, healthcare as a whole into simulation. So what keeps me into simulation is seeing that change, that every year something changes, every year you design new things, there are new things coming up, there are new teaching strategies. But the main goal and the main objective is to improve healthcare professions performance with a focus in patient quality and patient care, patient safety, and the quality of care. So what keeps me there is trying to bring that through simulation and through teaching, and also it is super cool. So that's why I'm here.
Yeah, we were thinking before, like every simulationist is an innovator in general, because you have to be thinking in new things every day.
Yes.
And how to solve new problems and how to get better though. And so the thing is, what do you think is the next step for the simulation and to embed simulation in Brazil?
So I believe it can be related to technology, but I see simulation more as a way of teaching, as a technique. The technique of simulation is very well established. It backs to the 80s, like the andragogy theory, and how an adult learner learns something. So the concept of simulation is really old, let's put it that way. But of course, new technology and innovation, it comes all the time. And as a simulationist, as an educator, you need to understand a better way to use those techniques, those strategies, those technologies, not to waste money. I always say that the best investment is on faculty, on the educators. You need to have good educators because they're gonna make the best use of the equipment you have. You don't have to have a $1 million human patient simulator with a hologram or whatever you want. So, but you must have good faculty, good educators, good operations specialists. So what I see in Brazil, that maybe, and that's what the society that I'm currently the president, Sobre assim, that's what we always try to do, is to bring the eyes of the public and the healthcare community as a whole to the educator, so they can understand a better way of using simulation and seeing the value of simulation, and how they can use that in their particular setting. It can be a university, a hospital, but it's that's what we try to bring to them.
And how do you see Sobrasim doing that? You know, that influencing, you know, the public market or the public into getting more into simulation. What do you think could be a good strategy in order to achieve this goal?
So we just had our conference, our National Brazilian Simulation Conference, which was at the AFIA group at in Rio de Janeiro at the Unigran Rio University there. So we hosted our conference. We had a bunch of people going there, lots of attendees, and we discussed simulation, how it works and how they can implement in their organizations. And we also have our WhatsApp groups, our blogs, our website that can serve as a resource for people interested into simulation. And we have our members that they broadcast what comes from the society to their organizations, and so we can serve as a hub for discussions and, of course, generating new knowledge through research. So we have a big connection between the board of directors of Sobrasim and organizations in Brazil, so we can deliver better knowledge and research and things like that.
That's interesting, though. Really interesting. Though. I don't think that. How do you see the digital technology is going to influence the spread of simulation education across the Brazil?
Yes, I think that's going to help a lot. But as I said, I think the focus should be on the person, on the faculty, on the staff that's going to be using it. Because I understand that if they're well trained, they can make so much a good use of the new technology coming up and close those gaps, create new bridges, and deliver content. Brazil is a continental country, so I believe that having people that know how to use the technology and being trained on that, and not just I use AI, I use machine learning for everything, which is everyone says now that he's a specialist or one is a specialist into AI, and we know that's not the truth. So they need to be trained and they need to understand the technology, so they can give a very good delivery into what they're trying to accomplish. So I believe that's how technology will help, but we need to focus primarily into the faculty and into the person itself.
That makes a lot of sense, man. It's really a lot of sense. I see a parallel, you know, like I come from the film industry, and in general, you have to have a good script and a good director. Maybe you can have special effects, but the special effects is not the most important thing, though.
Exactly.
The special effects always are going to complement whatever you have. But without a good director or a good script, you don't have a good movie. So that's
a very good analogy.
Yeah. So another question is as one of the major countries in South America, with pockets of simulation happening in other countries within the region, what do you see as Sobrasim role influencing your neighboring countries in implementing simulated practice.
Very good. So we work really close to the Chilean society with Professor Dr. Soledad Mijo. She's the president there, and we just started a partnership where our certified individuals in simulation in Brazil are also recognized in Chile and backwards as well.
That's a really
And also, we started the accreditation process for organizations in Brazil, so the sim centers can be accredited, just like SSH does this in America.
Okay.
So we started doing that in Brazil, and it's also recognized in Chile, and we recognize their accredited centers in Brazil. And also, we're really close to the Portuguese Society with Professor Gustavo, who's the president there, and we're doing some publications together, starting new collaborations, and that's how Brazil plays a key role, I would say, in Latin America, and also with our brothers from Portugal. We're really close, we speak the same language, and we have a really close understanding of simulation, and that's how we are planning to influence and expand simulation. And of course, in the US, we're an affiliated society with SSH, and I've been coming here for over the past 10 years, of course, not always as the president of the Brazilian Society, but we have a very good relationship with SSH.
Wow, very nice. Yeah, that's really good though. Like, so at the end, together you get stronger, and basically it's better to spread the word. Basically, it's yeah, that's makes sense. Well, historically, the medical simulation industry has not had outlets in Brazil. Overall, just some of the major brands. You know, like how difficult is to get access to the latest simulation technology in Brazil?
Yeah, I wouldn't say it's that difficult, but the main difficulty is not having it there, it's paying the price.
Yeah.
So some of the mannequins are extremely expensive in Brazil because of taxes and when they import it to Brazil and the profits. But we have all the major brands are in Brazil. I never had that difficult in getting anything that I actually needed for any particular case. And we also have some Brazilian companies coming up over the past 10-15 years that work with virtual reality. They develop simulators, human patient simulators, test trainers in Brazil. So I believe it's a growing market, and the major brands are there. And I can't remember that all of the sim centers that I ran implemented many sim centers in Brazil. So I can't remember that I needed that specific particular piece of equipment and I couldn't get, other for budget reasons. But I believe that part has been good.
So, well, you have a great platform here to invite all the innovators in simulation from the rest of the world to get to SobraSim. Maybe the next time how would you extend the invitation to make them take the chance in Brazil?
Sure. Well, I would love them to go to Brazil, get to know our amazing country, get to know our people, and also understand a little more how simulation happens in Brazil. And we just had our conference, as I mentioned, and we had 8 sponsors. Of course, it's very little compared to IMSH, which is huge and amazing. But compared to Brazilian standards in simulation, we had 8 companies in Brazil helping us to make our conference happen and supporting simulation in Brazil. So I invite all of you that maybe seeing us now that want to know more about Brazil. I'll be more than happy to be at your service.
Okay, like another big thing is, where does the simulation outside of patient simulation fit in SobraSim? Conferences like surgical, ultrasound, use of CPRs and ALS mannequins, for instance.
Yeah, we do more like demonstrations of, as I said, with those vendors, those manufacturers that support us. They bring their equipment, and we can demonstrate how they work at some point. And also we have some lectures and workshops where we use those equipment so people can have a feel of how it works, and before they buy, if they want to buy it. And sometimes we're just demonstrating in theory when should one use some sort of equipment, a test trainer, when they choose a simulated patient, when they choose a human patient simulator. So that's how we try to address that during our conference and other workshops that we host along the year.
Okay, and what do you think about the measurements of quality control in healthcare simulation, both in delivery by institutions and with regards to products that are sold? You have any thought about that?
I don't know if there's any sort of control about that in
Brazil.
Brazil.
Because it's an unregulated business that works over one of the most regulated things. Yeah, is healthcare. You know, the healthcare.
Yeah.
So it's
I don't know. I believe that every piece of equipment that is either manufactured in Brazil or is imported from Brazil, they have to have customs cleared. So I believe that prior to sell something, they need to go through all the due process to be cleared. And I can assume that those regulations are met if they're selling a medical equipment. So I can't say about that because I've never worked with it or had a look at any sort of legislation that what can or cannot be sold or be used.
So you told me also before when we were speaking, we are here like more going to me like speaking a little bit of everything, that not every hospital in general has simulation inside. Well, that happened in Europe as well. You know, like little by little they are getting to know, you know, that is necessary, and things are evolving a lot. You know, in that sense. How do you think, you know, like it's going to be like the simulation in the future, you know, like how do you see the future of simulation, like in the world that gets to more institutions, you know, in Brazil?
I believe it's going to be growing more, just like if we see over the past 20 years, it has been growing. Simulation in Brazil is really new. It's not compared to the US or dates back. If you think about pilot training, that dates back to the 40s, and they use in healthcare maybe the 60s or 70s. And in Brazil, that's really, really new, maybe back in the year 2000s or 2010s, where that really came more well known in Brazil. So I believe that's going to be growing and with more cost-effective solutions. So I don't see extremely high fidelity mannequins or virtual reality for everything or AI powered everything. So I'm more I like the technology, I like innovation, I work with it, but I think that simulation is a technique, and when you have good educators that know the theory, that they know what they're doing, they can use the technology and the equipment that they have to meet their measurable learning objectives. So I believe using more cost-effective solutions and focusing more in the training of the faculty would be a good future for Brazil.
The same thing happens in the film industry. Normally, the really good directors start doing, like, you know, their first film, and they don't have any money in order to do it, though. So they have to do a good directing. So in this sense, you know, like the same analogy I see, you know, over there, like you need to become a good educator, and little by little, probably it's going to be the necessity of evolving and maybe using some new tools to get better your performance. I don't know if you see that
Yes,
way.
I agree. I think that new things are coming, and but you need people that know simulation and understand simulation to choose the best tools that they can use for whatever they need.
A question: what do you think that holds more, you know, the growing of the simulation in general? Like the local culture in institutions, like for example in the hospitals themselves, or political maybe decisions, or it's a mix between both?
I don't think political decisions. least in Brazil, I'm just talking about Brazil. I don't think politics has nothing to do with that.
It doesn't have to do with left or right, you know. It has to do with maybe getting to know like the importance. Like for example, in a point of history, we get to know like if you wash your hands, you are going to get less people killed, you know.
Yeah.
Like we right now know that you get more simulation, you get less people killed in general.
Yeah.
That's
So I think that I don't think politics plays, at least from my point of view, but I believe that the local culture, like hospitals culture, some hospitals just don't want to invest in simulation because it's not something that they see a profit coming out of it, or they don't see the value of coming out of it. So I have many physicians, I have nurses, they're all trained, so why do I need to do simulation again and again and again? It's up to them go find their training. So some medical schools in Brazil still don't have simulation. They still don't believe a lot in simulation, or they have something but they don't use with the full potential that they could use. So I believe it's more the understanding of simulation and local culture, how Brazil has been built and the healthcare system has been built, other than any political regulation that would say, okay, tomorrow you need to to do simulation. You just mentioned the hand hygiene. Coincidentally, my PhD is in hand hygiene in hospital. So it's a very good example that you gave, that everyone knows that they need to wash their hands. But on average, only 50 to 60% of the hand hygiene opportunities in a hospital setting are embraced. And everyone knows that they need to wash their hands. So you see how curious human beings are.
That's interesting, though. Well, it's really good, though. Really good conversation. It's things that happen. It's something that continues to amaze me, you know, about the simulation. So I think it's a really good conversation that we have over here. So
thank you so much.
We are gonna thank you very much for being over here. So,
thanks for having me here.
Okay.
It's a pleasure. Thank you. Thank you so much.
Okay. Well.